Thank you for your waiting. Now I'd like to start again nursing forum in Japan. Now the closing session. In the first place, the summary will be presented from each concurrent session. My name is Akiko Araki, Executive Officer, GNA, serve as a moderator, representative of representing concurrent meeting one. Dr. Teshima, Chiba University, will speak about her summary. So in the concurrent one meeting, we have a theme of a triple impact and the policy. Particularly, we discussed the importance of evidence in order to have an impact on the promoting policy. In the first place, Akiko Araki, Executive Officer, GNA, spoke about triple impact and the Japanese nursing, which is relevant to the discussion theme in our meeting. So the nurses should be sure their own potential, and this will lead to the better health and promotion of gender equity, and also the development of economic growth. And particularly, she explained about the specific example of the SDG target 3, 5, 4, 8. Particularly, finance is very important for the nurses to be fairly evaluated. In this case, evidence is very important. Evidence should be presented for policymakers to understand to be justified the nursing care. And next, Dr. Sanada, University of Tokyo, spoke about triple impact and the policy, particularly policy research, make a difference on the precious so far. She emphasized the importance of evidence and also the necessity to show the policy research, particularly based upon cost effectiveness. Then we had the presentations from presidents of Canada, Ireland, South Korea, and Chile, Lebanon, Australia, Nursing Association, and they shared with us the importance of the policy, nursing policy, the use of evidence, and also significance of evidence, particularly leadership important, they said, and also the leadership training is very necessary for young nurses, and the nursing campaign has a nursing challenge, which is a sort of the project for us to participate in fostering a young nurses leadership training. And what is the commonality among those nursing associations is this. So clinicians, educators, researchers, administrators, and policymakers, and all nurses should collaborate with all stakeholders and to show the evidence which is relevant to the policy making. And also the nurses should be in line with align with the changing evidence, and also the evidence is very important. That has a very important role to play for nurses to show its own power, and particularly what the impact on the achievement of the triple impact should be evaluated at a later point. We are looking forward to this. And every one of us nurses raised our voices, taking the position of a leader and speaking our own opinions, and also the sitting on the table for decision making. And more than any other else, evidence is really necessary as a support proof supporting evidence for the policymakers to understand the necessary nursing care, and every one of us should raise our voices to communicate that evidence to the necessary places. In order to do this, evidence should be accumulated and public viewing, and also the Noriko Yamamoto, the Nursing University Association emphasized that the evidence making and also policy shaping should be educated during the undergraduate program, rather than a sort of the discussion which is rich in content we shared with each other. In order for us to participate decision making, human resources is very important. Fostering young nurses is really necessary. In this case, part of the Nursing Now campaign is a Nursing Nightingale Challenge, and Chiba University and JNA are participating, and the Nursing Challenge. In May, message the video will be made and put in place on the internet. Please watch that video. Thank you very much. Dr. Teshima, so every one of us raised the voices to communicate this kind of evidence. I understand very well. Dr. Teshima rightly said that the Nightingale Challenge, the VTR, will be a coming later point. So particularly the education for young nurses is very important.
Next, representing concurrent session 2, we would like to ask Dr. Etsuko Kita, Chair of Sasakawa Health Foundation, to present. Once again, I would like to congratulate the organizers and also the holding of this Nursing Now Forum in Japan as part of the bicentennial of Nightingale. We are very honored to be able to co-host this forum together with JNA. I'm very happy to see that many people have participated. In the session 2, we have been receiving financial support from Nippon Foundation to carry out this program for training personnel to be able to provide home care nursing. And we have heard, therefore, from the foundation as well as 3 experienced people in this field. And I think the staffs had a hard time trying to coordinate. But first, there were those Japanese presentations that were sent with English translation. And based on that, the English presentations were produced, and we received this. And it presented this to the Japanese presenters so as to create opportunity for people to share their views. But I think more or less things went well, though it was a complicated operation. I think many of you listened in to the discussions and presentations, but as a part of my colleagues, which are doing the Japan Visiting Nursing Foundation and National Association Visiting Nurse Service, and already we have completed 7 courses, and 74 people are already practicing, and at 85 locations they are operating these facilities to provide home care nursing. And we are receiving feedback to produce evidence. We will be producing evidence. And for this, JNA and the Ministry of Health, Labor and Welfare will be assisting us. Nursing is universal, and at the same time, it is something which is very humanitarian, and it is also science-based. I personally believe that it has to have all these 3 aspects. Well, nursing may appear to be a form of art, but AI artificial intelligence, ICT is talked about to be used in nursing, and nursing will take on a more scientific characteristic in the future, I believe. But the Japanese 3 presenters and also the 3 legendary presenters from overseas did talk a great deal about this aspect of nursing. Meanwhile, when we think about people in the field, yes, this was also presented, but treatment. And I think the nursing for treatment is established. But when it comes to community care and home care nursing, I think that this system has yet to be fully established. And the JNA is focusing on this. That is visiting nursing, at-home nursing. I believe that equity, equality, justice, these 3 elements need to be incorporated. And for this, we believe that nurses need to talk with the people in the community, understand how they think about health. This is an area I hope nurses will focus on in the future. In session 2, I think we gained a lot of insight as to how this can be done. And this was a summary of concurrent session 2. Thank you.
Thank you very much, Dr. Kita. Next, on behalf of current session 3, Dr. Sonoe Mashino, Executive Director of Research Institute of Nursing Care for People and Community of the University of Hyogo. Yes, in concurrent session 3, we talked about the continuation of nursing to the construction of disaster-resistant community and a safe and secure society. We first heard from Dr. Yoshiteru Murosaki, and he said that we are living in the day and age of disasters, and of course pandemic is a sort of a type of disaster, is what he said. And of course we cannot reduce the occurrence of disasters to 0. However, we can reduce the impact, and of course, robustness as well as the health of the community will help in that regard, and therefore community-oriented disaster prevention is what he talked about and mentioned the importance. And in doing that, the role of nurses and challenges of nursing in that setting was mentioned, because there are certain challenges. So we have to have community-based activities, but also have the necessary mechanisms established and systems established. And of course, we have to combine the expertise of the nursing community as well as other experts. So the contribution by nurses in the setting of disasters were mentioned. And in the second part, Dr. Walter Di Caro talked about the Italian nurses' response to COVID-19 pandemic. He's the president of the Italian Nurses Association. Now, in Italy, 70 nurses died of coronavirus, COVID, and actually 5 of them were as a result of suicide. And so there were a lot of difficulty on the part of the nurses in the field, given the great stress that they were under, given the situation. And there are many nurses that are expected to do the job as if things were normal. However, that was not the case. And one positive news was that the media took up this issue, and they really focused their attention to the activities by the nurses. So the national population, general public, came to understand what the
nurses are doing. However, there are vulnerabilities. For example, before the pandemic, the number of nurses in the field had been reduced, and that had an impact. And therefore, it's important that we exert leadership and voice our views. And also, we have to strengthen the measures to take for prevention of communicative diseases, among others, and also protocols for safety management and guidelines are being developed as well. So that was shared by Dr. De Caro. And in the panel discussion, we talked about how nurses, or what nurses can do for disaster-resistant society. And so there were reports about disasters in the past. For example, there were great Hanshin earthquake, and that triggered the various activities for disaster relief. And so such activities were explained, and also support for female as well as mothers and children in case of disasters. But not just limited to disaster. We have to prepare ourselves for a possible future earthquakes that actually have epicenter right under us. And there were activities that had a partnership with corporations, and also the fostering and training of nurses that try to reduce the impact of disasters based on the communities. Of course, Japan is disaster prone, and we have gone through major ones in the past, during which nurses have shown to be professions that have been engaged in various activities. And such activities, of course, will differ from one disaster to another. But in any disaster, I think there are many common denominators as to what the nurses are expected to do. And that is also the case in COVID pandemic. And in disasters, of course, not just disasters, but under normal circumstances as well, nurses are essential profession. We have to once again recognize that. And for us to live up to our abilities, of course, the nurses themselves should be and have to be protected as well. So the disasters, of course, focus their attention on protecting the people who have been hit by disasters, and they had no reservation in doing so. But they have to also think about self-care enhancements so that when something happens, people will be able to be better prepared. And therefore, the nurses, of course, will take measures for normal circumstances as well as disaster situations in mind as well. And disaster-resistant or safe communities is what we talk about. Rather than the nurses going into the community only after the disaster, it is important that from the normal times, the nurses be a part of the community to ensure or monitor health and safety of the individual residents, and also seek what should be done to strengthen the ties with the local residents from the peaceful times as well, normal times. And so this is what we should be working on. And also we talked about the past disasters and their experiences there, as well as what we are going through right now. And it's not good enough if we just address what is in front of us. It's important we don't keep it to our nursing community, but disseminate that and share that information to the outside world, outside non-nursing communities as well as other countries. So that is all from me. Thank you very much. Thank you very much, Dr. Mashino.
最後に
Then, in concluding this forum, we'd like to have President Toshiko Fukui, GNA, will extend us Nothing Now Nippon Declaration. Now, President Fukui has the floor. Thank you very much for your participation in this forum for long hours today. The Nursing Now Forum in Japan examined the importance of evidence in policymaking, community activities, and disaster preparedness response and recovery. It reaffirmed that regardless of social circumstances, nurses have the power to contribute not only to the health of individual people, but also to the fostering of a community health culture and to the development of a society in general. The activities and the practices of nurses are key to the achievement of the global targets of the Sustainable Development Goals, SDGs. Recognizing that nurses need to make more active use of their skills and expertise, we hereby declare that we will continue to work together as follows. We will contribute even more than ever to the creation of healthy communities and societies and the realization of a safe, secure, and healthy lifestyles for all people throughout the lifespan. We will participate in the decision-making process to promote respective transformations from policy to practice to enable nurses to meet the social needs and maximize their abilities in all settings. We will endeavor to accumulate a broad spectrum of evidence to contribute to better decision-making based on the best available evidence, and we will share Japan's effort and achievements with the world, striving to achieve the global SDG targets and the improvement of the health of the people around the world. Thank you. Thank you very much, President Fukui. Now, CEO Katsumata, JNA, will say a few words to close Nursing Forum. Thank you very much. So on behalf of the organizer, I'd like to say a few words in concluding our Nursing Forum in Japan. With this, we'd like to conclude Nursing Now Forum in Japan held by JNN and the Sasagawa Health Foundation. So thank you very much for your participation for long hours from morning session, Nursing Day and Nursing Now Week to the end of the forum. And also, I'd like to express my sincere appreciation to Nursing Now campaign, planning committee, and also this, today's speakers. So I hope today the discussion and the outcome will be lead to the first step for better future of nursing. This is coming to the end of the forum, but Nursing Now campaign will continue by the end of June. So I hope 30 member associations of the planning committee and also every one of our nurses to promote further this campaign. So thank you very much for your participation. Thank you.